Dr. Davidhizar, let's talk about diabetes. Just give us the lowdown of, number one, how dangerous it is, but very importantly, is there something we can do to not get it, or when we have it, to get rid of it?
Sure. Of course, the most important thing with diabetes is early detection. If you can find it early, we can stop all kinds of problems. But a lot of people don't understand that diabetes is a very serious, dangerous disease, and they go on about their life like they didn't have diabetes, and their blood sugars are high all the time, and that's when they get in trouble. Damages their circulation, and by damaging the circulation, you can damage their vision, damages their kidneys. So eventually that catches up with them, and they have all kinds of problems down the road. A lot of people who don't care of that, their circulation is so bad in their legs, they end up having toes amputated and even, parts of their leg amputated. And, you don't feel sick with diabetes, so it's hard to convince people sometimes that this is really important illness that needs to be taken care of. Well,
let me ask you a question here. Let me interrupt you here. Why is it that diabetes becomes so visible in the legs, in the feet? I mean, why is that?
Well, it's the furthest from our heart, and it has smaller blood vessels, and so it's frequently the place where you're going to have more trouble. And of course, then the nerves are there, which are get affected by the high blood sugars, and they have smaller blood vessels further away, and so that's typically the spot where people. It's real uncommon to have people have trouble with their arms and hands. They can, but it's real common in the legs.
I see. Because the blood vessels are lower, it's further away from the body, it's kind of hard to get, it's hard to pump it through and stuff like that, so that's where it easier becomes visible.
Right. And then also it affects the nerves there, which also causes problems. They get peripheral neuropathies, which causes some constriction of blood vessels as well, and so the problem just kind of keeps compounding itself.
Okay. So now, what, really like 1, 2, 3, if there is such a thing, what should we do to not get it? Let's first stay with not getting it.
Okay, well, the first thing with not getting it is keep your weight down and exercise. If you do those things, the odds of you getting it goes way down. But that's a problem in the United States these days. Everybody is sort of more sedentary. We eat the wrong foods. And so we're all becoming overweight, and that's the ideal setting to become diabetic, especially if there's any family history of diabetes. That increases your odds tremendously.
Is there a certain age where it becomes, the chances of getting it increases drastically?
Well, as the older you get, the more likely you are to get it, just because your pancreas doesn't work as well as it gets older. But you can get it at any age, of course. And if you have family history, it's more likely you'll get it younger. A lot of people don't get it until they're 70 or so years old. But the people that have it in their 40s or 50s and try to ignore it, those are the people that have the most difficulty because they're going to live longer. They've got longer time for that high blood sugar to damage their organs and their vascular system and to get them to the real problems.
Okay. Now, so let's say people with 40 or 50 have at least an onset of diabetes or perhaps already full-blown. What type of medicine, what type of operation, and what type of lifestyle?
Well, the first thing we always do is try to change your lifestyle, get them to lose weight, eat the right foods. And sometimes I've had a few patients that did that so well, their diabetes went away. We didn't have to do anything else. That's unfortunately not the normal case. And most people, even though they do that, usually I give people, if their blood sugar isn't too high when I first see them, I'll say, well, let's get you on a good program. Let's see if we can get the blood sugar down. Maybe you don't have to do anything else. And nobody wants to take pills or take shots. So most people opt for that choice. If after a couple months, 2 or 3 months, we don't really see the improvement we're looking for, then I start talking about putting them on pills. We start with pills first, and if that doesn't work, eventually we go to insulin shots and so forth. The main thing is to get that blood sugar down to where it's not going to cause them problems. And so we want to get down almost to what a normal person's blood sugar would be that wasn't diabetic. So we're very strict about that. Some physicians are pretty lenient and let people have high blood sugars. I I've seen too many complications from that. So we try to get people almost back to where you wouldn't be able to tell they were diabetic if you check their blood.
And you said that in 2 to 3 months on being on the regimen, you suggest or actually insist on it, from what I hear, they actually can make a drastic change.
They can.
That's pretty encouraging. I mean, 2 to 3 months is, so it's not like you need to do something for 7 years before you maybe see something. 2 to 3 months is a rather short time. I mean, so really that means lifestyle. If lifestyle change works in 2 to 3 months, then with no doubt lifestyle change must be the primary sought after thing to do, because boy, I mean, that's fast.
Yeah, it is the first choice always.
Mm-hmm. Now, what do you think when it comes to diabetes about certain supplement, like be it flaxseed, be it niacin, things I heard about who apparently are good for it?
Well, those things all help. Those actually affect the cholesterol, which is, of course, one of the problems. If you have high cholesterol and you have high blood sugar, that's really a bad combination. So, if you can get your cholesterol down, then you're not as likely to have difficulties with vascular disease from your diabetes. But, of course, the main emphasis, too, is also get the blood sugar down. There's natural ways to do a lot of this, and I always try to give my patients a choice between doing something natural or taking prescription medications. Many of them want to do the natural treatment, and we have several regimens that we offer to them to try, and to make sure it works. We check their blood, and usually in 2 or 3 months again, and if it's not coming down, then we recommend that we try something else. But most people can do well with some natural treatments if they're consistent with it.
So overall, you're in favor of natural supplements and stuff like that to help out with particular illnesses?
Yes.
Okay, absolutely wonderful. And you will be able to, because there's so much of it out, and it's confusing, and one cannot necessarily read and will not read all the books. So you basically know and will then recommend this, like on one thing you said fish oil, or you said at least salmon because it has that thing in it and stuff. So you will then be very specific in your diagnosis of what the person needs in terms of food supplements.
Yes.
Absolutely wonderful. So basically, for the people out there who like alternative healthcare. Why it's called alternative, I don't know, because it was around forever. But the point is, people who like that type of stuff and believe in it and want it, they don't need to go to a multi-level vitamin salesperson who doesn't know much except the vitamins he has that they apparently are good and maybe are. But he can go to an MD like you who knows the anatomy of the body and at the same time uses both of the best of both worlds. Basically, you're not only using standard medicine, but you also say, here's the food, here's the supplements, here's the type of exercise. Use it as a synergy.
Yes, I always give them the options, their choice. And of course, we want to make sure it works, whatever they choose, so we check them and make sure they're doing okay on it. They have to be consistent with it too, of course.
Right. Well, that's a wonderful thing, as you said, the checking. It's one thing to kind of know that, let's just say vitamin C is good for a certain thing, and another thing is, well, does it do the job based on the measurement, which as long as he comes to you, the doctor, he gets measured and goes, oops, your parameters in this area do improve, or they don't, so you need to change or increase the doses or add or whatever it may be.
Correct.
Absolutely wonderful. Well, I didn't know that you basically, also believe and recommend the, as I said, alternative healthcare, vitamin supplements and stuff like that if needed for certain things. Thank you very much.
You're welcome.